Time now for Sports Health, presented by Ochsner-Andrews Orthopedics and Sports Medicine Institute. Dr. Jeremy Burnham, our guest from Ochsner. Dr. Burnham, how are you?
Hey, I'm doing great, Hunt. Good afternoon.
Good afternoon. It's baseball season, which is my favorite time of year, but I think in your world that may mean a little bit of elbow season as well. I was looking at my notes earlier. Like South Carolina's ace is out for the year. Texas A&M's best reliever's out for the year. LSU's got a weekend started down. Mississippi State's ace is missing a little bit of time as well. And all the injuries are a little bit different. And it's not just guys that throw 100 miles an hour that have elbow problems this time of year. I know that you all see that, especially with some youth sports.
Yeah, absolutely, Hunt. And, it's almost getting to the point where when is it not baseball season, right? Especially down here in the South. I think we have baseball year-round. And but we do see the number of arm injuries ticking up this time of year, unfortunately.
Is that due to kids playing too much of the calendar, in your opinion, some of it?
Yeah, I think so. I mean, we're seeing these injuries earlier and earlier. And I think it's difficult as somebody who loves sports and grew up around sports, and everything I do is kind of involved in that. There are a lot of sports lessons that are learned through learning how to deal with discomfort, right? And so that's part of sports, that's part of conditioning, learning how to work hard and do those things. But there are certain types of pain that's not discomfort that actually represents injury, and we want our parents and athletes to know what to look out for.
So what could a parent be on the lookout for when you're talking about potential baseball and arm injuries?
The biggest thing is pain on the inside of the elbow. I mean, you mentioned you don't have to be throwing 100 miles an hour to injure the inside of your elbow. A lot of people hear about Tommy John surgery. Tommy John surgery is something that's done to heal to repair a torn ulnar collateral ligament, a torn UCL. So it's a ligament on the inside of the elbow. And it used to be something that you would see in more mature athletes, professional, collegiate baseball pitchers would have these injuries, but we're starting to see them in younger athletes as well. A lot of these athletes are still growing, and their body really hasn't caught up to them. And so I tell all my patients, all their parents, if your kid has pain on the inside of their elbow when they're throwing, that's not just discomfort to push through. That's something to take a break, to stop throwing, and then if it doesn't go away, you got to get that assessed.
No question about it. And you see so many kids that are specializing at such a young age that can cause burnout just mentally, and then physically there can be some lingering effects of that as well. You sent me some interesting statistics on NFL first-round picks. Like 88% of them were multi-sport high school athletes, and less than half of pro baseball athletes specialized in baseball. It surprised me a little bit because of just how much baseball you play. You can't really play a lot of spring football, but baseball kind of goes year-round. But there's just a lot of value medically, in your estimation, in terms of just mixing things up and doing different things year-round.
Yeah, that's right. And, we work real closely with Dr. Andrews, Dr. James Andrews, and he was one of the people that really first really popularized this Tommy John surgery. He was having a lot of athletes from all over the country come to him. And he's really made it a point later in his career as a Louisiana native to really try to make an impact on the youth injury rates. And one of the things that he always says is that you need to take, as a youth athlete, you need to take 2 or 3 months minimum. He recommends 4 months off of whatever sport you're playing, particularly baseball, because of the torque that it puts on the elbow. That's a hard thing to do. I mean, I have young kids that are playing sports, and there's a lot of pressure, peer pressure, I think, both for my kids and as a parent for your kid to play one sport 12 months a year. But based on what I see in my clinic, it's not the right thing. You mentioned the vast majority of NFL first-round picks, they did not specialize in a single sport in high school. Less than half of Major League Baseball athletes specialized in baseball. And the interesting thing is the people that did specialize in baseball in high school, they did not start specializing in baseball until the average age of 14. And then if you dig into those stats a little more, 70% of youth athletes quit sports completely by the age of 13. And that's a pretty big deal. And if you specialize in a sport before the age of 12, your risk of dropping out of sports completely is more than double somebody that plays multiple sports. And so there are just tremendous benefits to playing more than one sport. I think if baseball is your sport, I think playing other sports probably helps you in baseball more than you realize, in addition to helps you stay healthy.
I know for a fact that Jay Johnson loves guys that played quarterback in high school, loves guys that are athletic enough to do other things for sure. He's head coach of the best program in the country, right down the street there.
That's right.
You also told me an interesting deal about a grant that y'all were awarded last week. When I think about ACL recovery, I don't immediately think about oxygen, but that's something obviously that's vital. Can you tell us what y'all are working on?
Yeah, so, as you know, we have an ACL Center of Excellence over at the Elite Training Complex, and a big focus, speaking of youth injuries, right, a big focus of ours is trying to prevent ACL injuries And we had a guest speaker down several months ago that is one of the Cleveland Browns team doctors. And, Cleveland is really kind of a hub for orthopedic and sports innovation. So they came down here to do a guest lecture and give us a talk. And while we were discussing things, they were talking about some of the technology they're using around ACL injury prevention and ACL recovery. And one of the things is they were looking at some surface-mounted oxygen sensors to try to look at how well that muscle is oxygenating. And so, with that started, it sparked an interest in our research team, and we applied for a competitive grant with the Louisiana Orthopedic Association. Tommy Drazik is the primary investigator on that grant. He's from Wyoming. He's going to be an orthopedic surgeon. He just graduated med school, and he's spending a year with us basically to help develop some of these research protocols. And so he applied for this grant, competitive process, and we got some grant funding. And what we'll be doing is using these wearables on the quad muscles. The thigh muscles are so important to protect the knee. And that's whether you're rehabbing from an ACL injury or whether you're playing sports and you've never torn your ACL. And so we're going to be using this technology to try to monitor how well that oxygen gets to the thigh muscle and help change what we do from a rehab and an injury prevention standpoint to try to have better outcomes.
It's incredible stuff that happened right here in our backyard in Baton Rouge. Dr. Burnham, that's exciting, and we appreciate a little bit of time. We'll talk in a couple of weeks.
Thanks. Great talking to you, Hunt.
Dr. Jeremy Burnham from Ochsner, good enough to give us a little bit of time here.